to Why I Vaccinate, presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas, and I am here with my co host, Veronica McNally. And Veronica, as Michigan moves into the next phase of the pandemic, families are starting to get back to normal. Our first guest, Dr. Natasha Baghdasarian, the state's chief medical executive, is here with us now. And she is going to provide some great advice and important information about this stage of the pandemic. Doctor, thank you so much for being with us.
Thank you for having me on.
Start out and just talk to us a little bit about this stage of the pandemic. What is it?
Well, we are calling this the recovery phase. And what we're really talking about is looking forward at the pandemic as being a cycle and and there being peaks and valleys of cases ahead of us. So a lot of people in the media are portraying this time as, we're moving towards endemic COVID, and they're sort of portraying this as things are just going to get better and better, and then we won't have to worry about COVID anymore. And the truth of the matter is, we don't think that's the case. We think that there will be additional surges of cases. We think that there will be times when hospitals are under a little bit more strain. And so what we want to convey to the public is that we need to think about this as a cycle. We just got done with a surge of cases. We communicated a lot to the public about it was a time of high risk. Cases have come down in a very nice way. So things are relatively safer right now than they were just a month ago or a few months ago. And so we want to be able to communicate that things have changed and that we are in a relatively safer time. But also, we want the public to be able to understand that we're looking ahead and we're looking for things that could trigger another surge. And if we see conditions that put us in a period where we're preparing for another surge, we're calling that readiness. And we'll need to ramp up communications again and say another surge is coming, and then we would have another response. So it's going to be a cycle. There are going to be times that are relatively safer, and at times where hospitals get a little bit more overwhelmed and that cases go up. And what we want to do is we want to live in this recovery period for longer and longer periods of time, and we want to make those response periods as short and as least disruptive as possible. So that's the general idea about where we are right now. It's a safer period, but it doesn't mean that things are going to be safer forever.
What are some of the things that you will look for that will indicate to you that another surge is coming?
Well, in the beginning of COVID, it was all very unpredictable. And so what we were depending on were metrics. We were depending on looking at levels of cases in the community and then communicating to the public that levels were high or levels were low and to adjust behavior accordingly. And what we're talking about now is a more preemptive, proactive, looking forward type of predictive model. And we had a little bit of a practice with Omicron. So with Omicron, we were able to look at what was happening around the country, around the world, how other places were being affected. We did we used some really great modeling, and we were able to see when the peak would hit us, when the surge would be over, and it was all fairly accurate. And so we're looking to start thinking that way more and more in the future. And so, as you asked, conditions that we would be concerned about would be another variant of concern. So if there was another variant of concern on the horizon with higher transmissibility or higher mortality, or that could evade our vaccines, that would be a reason for us to get ready for another surge and to start moving into that readiness phase. We're also thinking about this as becoming a seasonal virus. So we think that we're expecting a surge perhaps next winter. Perhaps there will be an uptick in cases when schools reopen. So what we're looking at is something that has been fairly unpredictable until now. And the hope is that it will become more predictable and that we can start messaging ahead of time.
And Veronica, I know you've got some questions for Dr. Baghdasarian too.
Dr. Baghdasarian, what else are we able to get back to as a state? What have we not been able to prioritize, and what are we looking forward to being able to do public health-wise for our state?
Well, I think that in this time of recovery, it's a good time for us to start thinking about other public health issues that have maybe had less attention during these past 2 years. But it's also really a time for us to prepare for the future with COVID as well. So that means, what do we need to do to get ready for the next surge? One of our biggest tools is, of course, vaccination. So we have incredibly safe and effective vaccines. And this is the time to really start messaging some of those communities with lower uptake of vaccination, and start messaging to them that, there are going to be more surges. And the best way to prepare is to get vaccinated now. Or if you haven't had your booster, get your booster now. And then, of course, there are other childhood diseases. And maybe parents have not been visiting their pediatricians as often as they had before. So this is a good time to start getting other routine childhood vaccinations up to date. So this is a time where it's lower risk for COVID compared to a few months ago. We don't know how long it will last, but my hope is that at least as the weather gets warmer and people are able to be outside more, and that we don't have an imminent threat from a variant of concern, I'm hoping that this will at least last through the summer and spring. And if that is the case, it's really a time to for parents to work on things like, making sure their child is up to date with other vaccines, has been to the dentist, had all of those other routine types of healthcare checkups done.
What are you most looking forward to doing with your family, with friends, now that we're in this lower risk phase?
Well, we're in a lower risk phase, but it doesn't mean the risk is over. It doesn't mean we're not in a pandemic. So my plans for myself is, there were things that we had been putting off as a family. There were things that we didn't do during the Delta surge and the Omicron surge as a family. I have a 7-year-old and he's fully vaccinated, but we still worried. And so there were things that we didn't do. For example, indoor swimming lessons we didn't do. That's a place where you obviously can't mask. And I'm looking forward to restarting our indoor swimming lessons. Other types of sports activities that we had put off during these surges, I'm looking forward to getting back to those. But as a family, I'm still planning on taking some mitigation measures and some preventative measures. So this phase that we're in, for parents around the state, I really want to emphasize that even though we have taken down some of those really broad masking recommendations, so we had pulled down this public health advisory on masking in all indoor public spaces, you still want to make decisions that make sense for yourselves and for your families. And that means looking at who is in your family unit. Is everyone vaccinated? Are there people who are vulnerable for other reasons? And using your best judgment. We've had 2 years of practicing now and making decisions about COVID, but using your best judgment about what works for yourselves and your families. So in terms of masking, there are still some places where we as a state broadly recommend masking. So for example, in congregate settings, in healthcare settings, in long-term care facilities, in correctional facilities, we still recommend masking. We still recommend masking if you are quarantining or isolating from COVID. And there are still some local mask policies and federal mask policies that we want you to follow. But otherwise, as this becomes a personal choice, it means looking at your family unit and really seeing what makes sense for yourselves based on risk and benefit.
Is testing still really important?
Testing is really important. And when we talk about the tools that we have for COVID right now, I try to convey that it's a package of tools. And it's some tools that we've had since the beginning and some tools that are only recently part of our toolkit. So for example, since the beginning, we've had masks, ventilation, distancing as a great mitigation strategy. We now have the widespread availability of really high quality, well-fitting masks, which had been in short supply at the beginning. And they're more protective to the individual who's wearing them. With testing, we have had testing, since the early-ish days of the pandemic, but we now have ready supply to over-the-counter tests, which are a great way for you to be able to test at home if you're having a little bit of sniffles or if you think you've been exposed to someone with COVID. So an excellent addition to our toolkit. With vaccinations, we keep broadening the age groups that can be vaccinated. So we now have vaccines available for everyone over the age of 5. And then we've got therapeutics. So we have oral antiviral medications in addition to the monoclonal antibodies that we've had for some time. So when I think about the tools, there are tools that we've had since the beginning, but really in all of those categories, we've made some advances, and we have things that weren't available to us earlier on in the pandemic.
So where we have areas that have high risk transmission, how do families know about that? How do parents know?
So the way that I would think about this is a concept called a risk budget. And the first thing to think about is how much risk you and your families are willing to take. So everyone has a different family makeup, has different types of vulnerabilities. I mentioned before, it could be someone who's too young to get vaccinated, someone who has a lot of other medical conditions, and you're concerned about their risk of severe disease if they were to get COVID. It could be someone who's immunocompromised. So you think about who is in your family unit and who is in your extended family perhaps, and what types of risk you're willing to take. And I think for some people that could be continuing to avoid certain types of activities. So for example, going into a big unmasked gathering with hundreds of people, maybe that is something that you're not quite ready for. And that's perfectly appropriate. Then you would look at the risk of the community where you live. So the CDC has new metrics that came out that talk about different community risk levels. So we've got low, medium, and high. Most of the state is in low or medium at the moment. Only about 10% of our state is in that high risk category. And so in low and medium risk categories, that's a different decision-making process there as well. So it's your own personal risk budget. So how much risk you're willing to take, the vulnerabilities in your family, the unit that you live with, that you are spending time with, and then what's happening in your community. And then you can make decisions on what you want to participate in, what you want to avoid, and where you might consider either using a mask in certain settings or testing before gatherings. Those are all strategies that work. It could be that you would feel more comfortable attending a larger event if everyone is vaccinated. And of course, there will be some organizers who are still going to have their own policies in place about masks and vaccination. So that concept of a risk budget and making the right decisions for yourself, there's a lot of individual considerations that you have to take. And then there's also the part where you look externally at what's happening in your community. We do have some materials on our website, and I can see if I can get you a link after our conversation talking about understanding your personal and household risk.
Are you hearing from parents? You mentioned that you have a 7-year-old that's vaccinated. Are you hearing from parents who are still concerned about having their children vaccinated?
I do hear from people even in my own social circle who are still sort of have questions about getting their children vaccinated. And we clearly see this in our vaccine data when we look at what's happening around the state. So one of the things that concerns me the most is we had really great vaccine uptake in our over 65-year-old population. And then with each decade, vaccine uptake goes down. And our vaccine uptake is lowest in our 5 to 11-year-olds. So statewide, it's about 27%. And then there are pockets, there are counties that have much higher vaccine uptake in that 5 to 11-year-old age group. So there are some counties that are as high as 57%. And then there are counties that are much, much lower than the statewide average. And that's what concerns me. And that's also where we start seeing a lot of inequity in terms of race and ethnicity. So this vaccine hesitancy, especially amongst younger age groups, it seems to be hitting certain communities around the state and certain racial and ethnic groups harder. And that is going to leave communities at risk. And that really concerns me because we know how safe and effective these vaccines are.
Do you think that the recent information study that came out that indicated that the vaccine did not keep children from getting COVID, of course, it kept them from getting very, very sick or hospitalized? Do you think that that information is playing a role in this?
Well, this lower vaccine uptake has been going on for months now. So this is not a new phenomenon. But yes, I think that study raised a lot of discussion. And for me, as an infectious disease physician and epidemiologist, when I look at that study, my top line takeaway is that these vaccines prevented severe outcomes in children. And to me, that's the most important factor. Is it possible that that age group will at some point need a booster in order to better protect them from transmission? That's possible. But the way that it was interpreted and the way that it was discussed in many media outlets was the vaccine is not effective in the 5 to 11-year-old age group. And to me, that is not the takeaway point at all. That should not be the top line message from that study.
That's important information to know. Now, do you expect that we adults will need another vaccine down the road, maybe in the fall or the winter, almost like a flu vaccine?
I think it's really hard to say because the virus has only been with us for 2 years. And the vaccines have been with us for just over a year. And so it becomes very difficult to know what the long-term immunity is from the vaccine when we just haven't had long enough to study it. So I know that there are a lot of members of the public who feel they get concerned when new recommendations come out and they say, well, the science is changing or you don't know what you're talking about. But the fact is, the virus and the vaccine have just simply not been with us long enough for us to know those types of long range implications. And so, yes, the data may suggest that there is another booster required, but we really need to give enough time to study these types of long-term implications.
Dr. Natasha Baghdasarian, Chief Medical Executive for the state of Michigan, thank you so much for your time today and this really important information.
Thanks for having me on.
You are listening to Why I Vaccinate. We will be back right after this.